Hello guys, let's read a couple questions here and talk about that so we can remember later if you drive those knowledge and thinking in your mind till you're driving or doing something else, some kind of review. So here we go. Let's see. Let's do the next question. Here we go. He said bleeding he has been difficult to control. So in the last week the patient has had both of epistaxis that occurred with minimal trauma. These patients were previously able to control the bleeding episodes by pitching the nose and using ice, but this has not stopped the bleeding today. The temperature is normal, pulse 160. Examination showed an alert child is well developed, anesthetic, and pale. Alert, he is well developed. Laboratory studies are the following here. Hemoglobin is 7, platelet is 22, too slow. Hemoglobin too slow, leukocytes is 2000, coagulation status, morphological normal appearance, leukocytes, erythrocytosis, and platelets. They look normal. Which of the following is the most likely cause of these patients bleeding? Why these patients bleeding? 1 year old boy. I have a lot of petechias. Acquired fibrinolytic dysfunction. B. Circulation thrombocytosis removal by macrophages. C. Decreased megalocytosis production. D. Diminished liver coagulation factor system. E. Microvascular thrombosis with erythrocytes lysis. F. Reduction of protein involved in plateletization and aggregation. So I'm gonna pick E. Microvascular thrombosis with erythrocytes lysis. I'm not sure. I spent too much time in these questions and we have only 1 minute and 30 seconds. 1 minute and 30 seconds for each question. So we have to practice. We have to learn how to read faster because we have just 1 minute and 30 seconds. So this is something that you develop during practicing hard, doing a lot of hours of practicing, doing a lot of questions, a lot of Q banks. So what happened here? Let's see. Decreased megakaryocytes production. Decreased megakaryocytes production. So they say these patients have anaplastic anemia. Multiple potential hematopoietic stem cells are destroyed by the cytotoxic T cells or direct cytotoxic injury. Bone marrow aplasia, hypoplasia, lack of circulation, peripheral blood cells. Common triggers are autoimmune, drugs, ionising radiations and toxins, viral infection, manifestations of anemia, fatigue, weakness. Thrombocytopenia, bleeding, bruising. Diagnosis: bone marrow biopsy. Spontaneous epistaxis, petechia, ischemia often indicate underlying coagulation disorder of platelet deficiency. Because these patients' coagulation study PT and PTT are normal A coagulation disorder is unlikely. However, the presence of pancytopenia and diminished morphological normal cells of peripheral blood smell strongly suggest aplastic anemia. Okay. Presence of pancytopenia and diminished morphological normal cells in peripheral blood smear strongly suggests aplastic anemia. And aplastic anemia is a form of the arterial bone marrow failure, typically because the direct toxic injury or toxic T-cell destruction of multiple potential hematologic stem cells. These reduce production of the precursor cells, by example megakaryocytes, that generally all blood cells lines, that generally all blood cells. Okay, it's like a more important megakaryocyte. This is more affected. In kids can be triggered by virus, hepatitis, parvovirus. Parvovirus, this is important, this is IgL. The parvovirus is very frequently in kids produce aplastic anemia. Patients generally present with symptoms of anemia, fatigue, dyspnea, thrombocytopenia, bruising, bleeding, petechia, or leukopenia. Examination will not show hepatosplenomegalia because significant extramedullary hematopoiesis does not. Definitive diagnosis is made with a bone marrow biopsy, which usually show profound hepatocellular and fatty infiltration. Okay, guys.